Dental disease in animals is very much like it is in humans. There can be long-term ramifications that affect the overall health of the animal. Cardiac disease, heart disease can be aggravated by bacterial load in the mouth. And so one of the things that we do just on initial exam when you come into the clinic is we take a good look at your dog or your kitty cat's teeth. We look at the gum line, we look for gingivitis. Dogs and cats can both get gingivitis. They can get cavities, they can have fractured teeth. When we are physically looking at your animal's teeth, we can actually only see a third of the tooth. 2/3 of the tooth lies above the gum line. And so that's where common dentals and frequent cleanings come in handy. We value our patients and we value our clients, and we feel like they deserve the best, and for that reason we do what we call an extensive dental procedure, because it seems fruitless to take an animal, take care of a problem, and not fully take care of the problem. It's kind of like going in and getting your brakes changed and you have 2 brake pads that need changing, but you only change 1 brake pad. Overall, it's not going to do the animal any good. We consider that a waste of money. So for us, it's a quality issue. The first thing that happens when your pet comes in, it gets checked in. The technician goes over everything to make sure that we're all on the same level as to what your animal is having done today. And then the animal gets a name tag for safety purposes, although we know most of your pets by first name very lovingly. And they come in the back, and then before any anesthesia is administered to your pet, a full physical exam is done. And that is because things can change in a day. Even if we saw your pet yesterday, your pet's heart will be listened to again, the teeth will be looked at again, the eyes, the ears, the lungs, the abdomen, and the temperature is taken. Because the last thing we're going to do is anesthetize an animal that's sick that day. And so a full exam is done. If there are things found on the exam that are new that the client is unaware of, we will call them and we'll let them know, and let them know if there's any increased risk or we need to modify the drugs that we use for anesthesia. We actually scale all the teeth. We go underneath the gum line and scale and get all the tartar and calculus off. Because sometimes we'll have a big chunk of tartar or calculus that will get off, and then there'll be a big pocket and an abscess, and so we may need to x-ray that tooth and make sure that we don't need to take out that tooth. We polish all the teeth, and then the next step that we do is we actually go and we measure the depth underneath the gum. You don't want more than a 2 millimeter depth. If there's more than that, either the tooth needs to come out or we need to pack it with some antibacterial solution to make that gum tighter, because those are pockets or areas where they can get infections. We see which teeth need to come out, which teeth need antibiotic solution put up there in the pockets, and from there we go on and proceed with the dental. Some animals, this will be the end of the dental. They've been polished, they don't have very many pockets, the tartar and calculus has been cleaned off, and they don't need any teeth removed. For other animals, this is the middle part of the dental. In those cases, depending on where the tooth is, there are teeth that have different roots. The front teeth have 1 root. The back teeth have 2 to 3 roots. Each root needs to be extracted separately, or they can break off in there and stay in that jaw area and cause an infection later on. We give all animals that we do dental work on antibiotics, and the reason for that is even if it's a simple, what we say is simple scaling and taking tartar and calculus off, all of that's bacteria, which has a propensity, it can spread to the body. So we treat them with antibiotics because we're basically creating a shower of bacteria as we're taking the bacteria out of the mouth. The drugs we may use for a younger healthy dog may be different than an animal that's older that has a heart murmur. And the reason for that is that different anesthesia drugs are processed by different organs in different ways. And so what we do is we do tailor-made anesthesia. So based on that animal's individual health, we use the proper medications that are necessary to keep them as safe as possible under anesthesia. We have fluids running through the whole anesthesia procedure because anesthesia does drop blood pressure, and it's really important to keep that blood pressure up to keep the organs functioning properly. So we keep them on fluids, we wean them off, we make sure they're coming out of anesthesia okay. Some dogs may need some extra medication at this point. They may be a little bit dysphoric, and like I said, it's individually tailored. And their temperature is monitored the whole afternoon as they're waking up. They go home in the evening when they are fully awake. And at discharge, we go over instructions with clients. There are finger toothbrushes, toddler toothbrushes. We encourage our clients to find out what the dog tolerates best. Some dogs are okay with you sticking your finger and rubbing it in. Some get a little testy and would rather have a toothbrush. There's so many different flavors of toothpaste. You find one that the dog likes. It's all about, or the cat, it's all about adapting to them. For the animals that really will not tolerate brushing, it's not worth getting scratched up or bitten and forcing them to brush. There are dental chews that have an enzyme on them that are meant to work on that calculus and tartar and kind of dissolve it. So I always tell clients, for any kind of product, shampoo, toothpaste, everything, you want to use pet products. They're formulated differently and they're different than us.